Welcome to the MS&Me Radio Network. The broadcast shows are for informational and entertainment purposes only. They are not designed to provide listeners with specific personal, medical, or counseling advice. Individuals with a medical issue should always consult their healthcare provider. MS&Me is not responsible for content of individual shows. The views expressed by show hosts or their guests are their own. Enjoy the show.
I'm John Strum, and this is RealTalk MS. It's January 8th, and I want to start by wishing everyone a very happy new year. We're officially 1 week into 2019, and I think that for lots of different reasons, this is going to prove to be an important and maybe even a pivotal year for the MS community. Whether you're thinking about important advances in MS research, new disease-modifying therapies reaching the market, a greater emphasis of the importance of involving people living with MS in MS research, better symptom management options, greater focus on quality of life and overall well-being, and a better understanding of how comorbidities impact disease activity and disease progression in MS. And just a review, comorbidity is a word that you're probably going to hear a lot this year. The definition of comorbidity is a medical condition that exists simultaneously with and usually independently of another medical condition. For instance, we often talk about the fact that depression is a common comorbidity in MS. Well, we're going to be hearing about all of these important topics in 2019. So when I open every podcast episode by telling you that we have a lot to talk about, well, it's going to be even truer in the new year. So I hope you can tell I'm excited, because in science, progress creates more progress, faster progress, and better answers. Doors open faster, riddles get solved sooner, and all of that ultimately leads to good things for people affected by MS. So I'm excited to be looking ahead to what 2019 has in store. And unfortunately, the first thing that 2019 had in store for me was the flu. Even though I got my flu shot a couple of months ago, I haven't been spared. So it's been a less than exciting first few days of the new year for me, and if my voice sounds a little more nasally today, well, it's because it is. My guest today is Dr. Nancy Chiaravalloti. Dr. Chiaravalloti is a director of neuropsychology and neuroscience laboratory and traumatic brain injury research at Kessler Foundation, and an associate professor in the Department of Physical Medicine and Rehabilitation at Rutgers, New Jersey Medical School. I'm going to be talking with Dr. Chiaravalloti about some extraordinary work that she's done in pioneering ways to not only improve cognitive function for people living with MS, but in using MRI to actually see these improvements in the brain. But before we get to my conversation with Dr. Chiaravalloti, there are a few other things that you should know about. A group of researchers has created a new online tool designed to assess patient preferences among people living with MS. If you've been keeping up with the literature and the practice of medicine, you've probably witnessed the increasing importance of shared decision-making, making sure that clinicians are having conversations with their patients, as opposed to delivering monologues to their patients. So understanding the things that are most important to a patient is a necessary aspect of shared decision-making and an important component in creating an effective treatment plan that a patient is more likely to follow. The research team recruited people between the ages of 21 and 75 who had been diagnosed with MS, and 135 of these participants went online to try out this new assessment tool that was designed to clarify, summarize, and share their treatment goals and preferences. Now, the primary goal of this project was to evaluate the effectiveness of the online assessment tool itself, and it proved to be very effective. but I thought I'd share some of those patient treatment preferences with you. When it came to treatment goals, 28% of the respondents indicated that their brain health, memory, thinking, cognition, preserving their brain health was their number one treatment goal. 17% said that disability, concerns about walking, strength, and vision was their number one treatment goal. 12% of the respondents said that symptom management for things like fatigue, bladder issues, and heat sensitivity, that was their number one treatment goal. And another 12% identified avoiding relapses or progression as their number one treatment goal. And although depression affects about 50% of the people living with MS, no one in this group of 135 indicated that managing depression was their number one treatment goal. Now, when it came to identifying what is most important about any disease-modifying therapy, 50% of the respondents indicated that the most important attribute of any disease-modifying therapy was its effectiveness, whether it slowed progression, disability, relapses, MRI lesions, and symptoms. 12% of the respondents indicated that the most important attribute of any disease-modifying therapy was its safety profile, whether it carried with it any serious side effects or had a negative impact on the health of their liver or produced birth defects. And about 15% of the respondents indicated that the most important attribute of any disease-modifying therapy was its effect on their overall quality of life. And in measuring the factors that motivated someone to change their MS treatment, about 59% of the respondents indicated that the most important reason to change your treatment was disease progression or relapses. 20% of the respondents indicated that the most important reason to change their treatment was learning about other treatments, either better treatments or holistic treatments that were not disease-modifying therapies. And 7% of the respondents indicated that the most important reason for them to change their MS treatment was financial, either the cost of the treatment itself or a change in their job status that impacted their insurance or their overall financial picture. So when you look at these varied responses, it becomes pretty clear that not only does MS affect each person differently, but each person living with MS has a very different perspective about what they're hoping their MS treatment is going to achieve, along with the specific factors that even affect their decisions about any particular treatment. And this difference in defining the goals of MS treatment, that's all the more reason that a successful MS treatment plan is one that requires a conversation, so that your neurologist is clear about your goals and expectations when it comes to prescribing the best treatment option for you. If you're interested in checking out this research in more detail, you'll find a link in today's show notes. Last year, I know we had more than one conversation. Actually, we had several conversations about the connection between the gut microbiome and MS. The connection wasn't completely clear, but research from multiple sources made the case that this could be an important connection. And last week, a research team from the University of Toronto and UC San Francisco announced that they had discovered that the intestine is the source of immune cells that reduce brain inflammation in people with MS, and that increasing the number of these specific cells blocks inflammation entirely in a preclinical model of MS. The cells are plasma cells, white blood cells that start out as B cells in our bone marrow, but change their behavior when they're triggered by microbes in our gut. By studying mice and samples taken from people with MS, the research team found that the plasma cells that reside in the gut and produce an antibody called immunoglobulin A actually migrate to the central nervous system and produce an anti-inflammatory effect during MS flare-ups. So our conversation about the connection between the gut and MS has become much more focused and much more important. The research team also found that increasing the number of these immunoglobulin A plasma cells that migrate from the gut to the brain actually eradicated neuroinflammation in mice. Now, there is a big difference between a mouse brain and a human brain. But this discovery at least suggests a therapy that could be developed that would expand the number of these cells in the gut, and perhaps we would see the same outcome, the eradication of neuroinflammation. So there's a lot more science that has to happen before we can assume that would be the case. But as I said just a few minutes ago, in science, progress creates more progress. And this new discovery certainly represents important progress. If you'd like to learn more about this study, I'll include a link in today's show notes. Former First Lady Rosalind Carter once said there were 4 kinds of people in the world: those that have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need caregivers. And for a number of pretty good reasons, I think that caregiving should actually be classified and treated as a public health crisis. Whether you're talking about the financial burden that goes along with being a caregiver, or the emotional burden that can lead to caregiver burnout, caregivers require a better system of support. It's not that the resources aren't out there. It's that right now, there isn't a prescribed method for effectively connecting caregivers to those resources. Too often, we don't turn our attention to caring for the caregiver until they're already experiencing problems. It's sort of like waiting to teach someone to swim until they're already starting to drown. At that point, everything becomes much more difficult and far less helpful. That's why this past November, I brought up the concept of what I call the caregiver protocol, a series of steps that begin in the neurologist's office when someone receives their MS diagnosis. These are steps that are designed to proactively help caregivers get a jump on self-care. And that not only benefits the caregiver themselves, but a caregiver who maintains their sense of overall balance in life is going to be a better caregiver. And that directly benefits the person that they're caring for. The caregiver protocol becomes even more important if someone is diagnosed with progressive MS, because we know that someone living with progressive MS is going to require more support. And that's going to require more from their caregiver or their caregiving team. So in the coming months, you can expect to hear more about the caregiver protocol and family-centered care practices for families affected by progressive MS. Many people living with MS are living with sleep-related problems. This might mean that they find it difficult to fall asleep, difficult to stay asleep, or they find themselves waking up too early on a regular basis. Well, a researcher at the University of Kansas Medical Center is recruiting 40 people living with MS for a study to determine whether web-based cognitive behavioral therapy for insomnia intervention might be a viable treatment for MS-related sleep issues. Determining whether cognitive behavioral therapy can mitigate MS-related sleep issues and further determining whether it can be accessed over the web would be a big step forward in potentially making this sort of treatment accessible to anyone who can connect to the internet. If you'd like to be a part of this study, you need to be between the ages of 18 and 80, speak English, have a high school diploma, and you need to have been diagnosed with MS. You need internet access, and you need to have reported difficulty falling asleep, maintaining sleep, or waking up too early at least 3 nights a week for the past 6 months. You'll find a link to the study details with the contact information for the principal investigator in today's show notes. So this is an opportunity for you to be a part of MS research. Toward the beginning of today's episode, I mentioned that in one recent study, the number one treatment goal for people living with MS was preserving their brain health. Things like memory, thinking. Preserving cognitive function was most important, and I get that. When my wife Jean began to experience cognitive decline due to MS, it was more frightening than when she experienced physical disability. It was like seeing a part of who she was start to disappear. And that can be frightening. So, being able to improve cognitive ability is a huge step forward for someone living with multiple sclerosis. In a moment, we'll meet my guest, Dr. Nancy Chiaravalloti, and we'll find out how she's making that possible for people living with MS today. My guest today is Dr. Nancy Chiaravalloti. Dr. Chiaravalloti is the Director of Neuropsychology and Neuroscience Laboratory and Traumatic Brain Injury Research at Kessler Foundation and an Associate Professor in the Department of Physical Medicine and Rehabilitation at Rutgers, New Jersey Medical School. Dr. Chiaravalloti conducts research in cognitive rehabilitation, particularly in new learning, memory, and processing speed, and Dr. Chiaravalloti has done extensive work focused on improving memory and cognitive processing for people living with multiple sclerosis. Welcome to the podcast, Dr. Chiaravalloti.
Thank you. Thank you for having me.
You know, when people are diagnosed with MS, their neurologist might explain how MS destroys the myelin sheath that protects the nerve fibers in their central nervous system, and that destruction, or demyelination, inhibits clear communication along their central nervous system, which can result in physical disability. But how does MS impact someone's cognitive abilities?
That's a great question. I think what the most important thing that everyone has to remember is everything that we do all day long happens from our brain. Our brain dictates everything we do and controls everything, and that includes cognition. So when you try to remember something, you are taxing your brain in trying to remember that information. So in MS, when the myelin sheath is not optimally functioning, what's happening is the neurons are not able to communicate effectively. As a result, your cells can't communicate as well as they should, and you have difficulty with cognitive tasks, such as remembering information. It may also be portrayed as slowed processing speed, which is very common in MS. So people with MS often show slowed processing speed, which is simply difficulty processing as much information as someone who does not have MS would in a circumscribed period of time. And that happens for the same reason. The myelin sheath is degraded and the information is not traveling from one neuron to the other as quickly as it should be.
So can you tell us about some of the work that you're doing that's designed to help people living with MS improve their cognitive processing speed and their memory?
Sure. The focus of my work is on cognitive rehabilitation. So when you use the term cognitive rehabilitation, what we're referring to is a program or any program that can help someone with cognitive impairment restore normal functioning or compensate for cognitive deficits. So cognitive rehabilitation entails an individualized program of skills training. So it's not simply going on playing a video game to try to improve your speed of processing or your attention. It's a specific protocol that's designed to improve someone's cognitive capacity. The work that I have been doing, and we've been doing at Kessler Foundation over the past 15 or 20 years, focuses on deficits that persons with MS are experiencing in their daily lives. So one of the most common cognitive impairments in MS is in new learning and memory. People with MS often have difficulty learning and remembering new information. So one of the programs that we've been working on for the past several years teaches patients with MS to utilize different skills to help them learn and remember new information. The program that we've been working on for several years is the modified story memory technique. And what we're teaching patients is to utilize strategies to help them learn information, specifically context and imagery. So what we're doing is teaching someone to take verbal information and create a mental image that's associated with that information. Our research has shown that by doing that, people who have been trained in the technique show better behavioral performance, so they're able to learn and remember more information after treatment. They also report improvements in their daily life, so they feel they're doing better in their daily life functioning. We've also been able to document that on some of our testing. And the third thing that we're showing, which is really incredible, is that the brain is actually changing in its the way it actually is learning and remembering new information. So what we're showing using functional imaging is that from before to after treatment, people engage additional brain areas in learning information. So we see, as I mentioned, we are training people in visual spatial skills, so being able to create a mental image that goes along with verbal information. And what we're showing through our neuroimaging is that areas of the brain that are responsible for these imagery skills are more activated after treatment than before treatment. So not only are we showing this change that we want to see on our testing in a laboratory setting, but we're also showing that people are improving their daily lives and the brain is actually learning and remembering information differently that's leading to this more efficient learning ability.
That's just remarkable to listen to as you say it. And I know that you've been the pioneer in actually being able to correlate this cognitive improvement with neuroimaging findings. So when you say we see the brain learning differently or finding ways to remember things differently, you literally mean you've been able to see that visual difference in how the brain functions. Is that right?
That is exactly right. And we're actually using imaging more and more in we have several different cognitive rehabilitation protocols that we're testing now. And we're using imaging more and more to be able to see those changes with different patient populations and different testing protocols. It's really amazing that through a behavioral intervention, so there's no blood draws, no shots, nothing physical happening with the body. We're simply teaching people to use different techniques. We're seeing the brain change in how it's processing and remembering information. So it really is phenomenal what we're able to document with some of the research that we've been doing.
I know that our cognitive abilities have just a profound effect on how we process so much of our day-to-day lives. And I think that in a lot of different ways, our cognitive abilities also play a role in defining who we are or how we are. My wife, Jean, is living with progressive MS, and when she began experiencing significant cognitive decline, it was as though a part of who she was began to fade. And honestly, that was scarier than when she began to experience physical disability. Cognitive rehabilitation, though, it isn't something that's always discussed during an appointment with your neurologist. Do you find that cognitive rehabilitation is being made available to people living with MS as often as it should be?
No, and that is because the research evidence is really just building now. There is a lot of data out there now showing that cognitive rehabilitation does help people with MS, but that really is very recent work. And much of that work was spearheaded here at Kessler Foundation. So we really focused in on cognitive rehabilitation itself, specific protocols, and how those protocols impact measurements of cognitive abilities. The reason we did that is because the more evidence we can provide with data showing that there are reliable changes after someone completes a cognitive rehabilitation protocol, the more likely that insurance companies will pay for these services. And that's essential. We really need the insurance companies to reimburse clinicians for these services so that they're accessible to the patients who need them.
Dr. Chiaravalloti, thank you so much for focusing on an area of MS rehabilitation that is so important, but it's just beginning to receive perhaps the appropriate amount of attention that it should. I'm really hopeful that some of our listeners plan on going to their next neurological follow-up appointments and speaking with their insurance companies armed with some questions about cognitive rehabilitation. And thank you again for taking the time to talk with me today.
Very happy to be here. Thank you for having me.
Well, that's going to wrap up this episode of Real Talk MS. If you haven't yet, don't forget to visit the Apple App Store or the Google Play Store and download the Real Talk MS app for your iOS or Android smartphone or device. You'll never miss a podcast episode, and the app allows me to share all sorts of bonus content with you, and I think you're going to find some great bonus content coming your way in 2019. So I hope you'll take a moment and download the app today. My name is John Strum. Thanks for listening, and we'll catch you next time.